Hi everyone, my name is Brandon. I'm a student here at Western Sydney University, and I'll be your moderator this afternoon. So how this will work, we've got Roy and Rocco on with us this afternoon, and they'll be here to answer any of your questions about the course, being physiotherapy, and they can explain things to you that you may not have, or explain questions to you in a way that someone else may not have in the past, because these guys are pretty much the experts on the course. So how this works is that they'll open up with a quick intro about the course, and then if you type any of your questions here below or in the comment section, I can pass those questions on to them and they can answer them for you. So I'll hand it over, and without further ado.
Yeah, thank you, Brendan. So my name is Roy Chung. So I'm a professor in physiotherapy. Welcome all to this session about us. So just give you a very quick introduction of the program. So our school is committed to providing a high quality 4-year physiotherapy training for our students. So our program has just gone through the regular accreditation review this year, and we are one of the highly regarded physio programs in the nation. So I would say a real strength of the program is the focus on meeting the needs of the Western Sydney communities. And our curriculum has been designed to ensure students acquire the necessary skills and knowledge in academic units before undertaking clinical placement in the 3rd and 4th year of the program. And the clinical placements cover all the core areas of practice and across the lifespans, such that the graduates are competent physiotherapists and they are eligible for registration when they finish the program. So here we also have Mr. Rocco Cavalli, so who is the academic course advisor. So we welcome any questions from you.
Hi everyone, looking forward to it.
All right, great. Well, we do have our first question, and it's coming from Bridget. So the first question is it possible to transfer from sports and exercise science to physiotherapy if one were to choose to change their course throughout their studies? If so, what are those requirements?
Yep, so I'll start, just jump in if you want, Roy, at any time. You absolutely can, and that's all handled through UAC. So if you do have any internal transfer, assuming you are at Western Sydney, internal questions, you can go onto the UAC website and contact them. Just keep in mind, it is very competitive. So usually internal transfers, well, historically, they require a GPA around 6. But even getting that GPA doesn't guarantee transfer because it depends on each year's cohort and the entry requirements for that year. So if you're already in a course, make sure it's a course you really, really enjoy, which is great. But yes, you can transfer, and it's done through UAC.
Great. So we have another question come in, and I'll follow up with my own question soon after. So if prospective students don't achieve the required ATAR to get direct entry into physiotherapy, is there a way to gain entry into the course through the Bachelor of Health Science? And following on from that, are you able to talk about some other possible pathway options that applicants may have?
Yep, sure. So you can. The Bachelor of Health Science is a good pathway. So your options, if you don't quite get the ATAR, which this year I think is around 95, is you can apply for a more common course like health science. You could go through sport and exercise science, like I said, podiatry, OT, and little bits of paramed. All of them have the same core units. So the first year to 2 years of those degrees are the same, very, very similar. So you'll be covering core competencies in professional health practice, communication skills, human anatomy, things like that. So you can absolutely do something like health science to start off with. Then after your first year or two, if you have a good enough GPA, you can apply through UAC to transfer into physiotherapy. But like I said before, keep in mind it is very competitive. So don't go into a course thinking, oh, I'm only doing this because I want to transfer into physio. Pick a course that you still think, oh, I'm going to love this, even if I'm not lucky enough to transfer.
That's some really good advice, and that's advice I give prospective students at the Future Students course information team all the time. It's always good to go in with a goal, but if things don't go to plan and you don't achieve that goal, you have to be comfortable with whatever path you're kind of already set on. So you've just talked about different courses. So my question, I think you've partially answered, is advanced standing. So just to confirm, what course do you recommend doing to get the most credit? Was it, sorry?
Yeah, so your options, health science is common. So the first 2 years are common. So if you do health science, podiatry, OT, physio, obviously, all of them have the same first 2 years essentially. So you'll get if you do it at Western Sydney, you'll get your advanced standing for the bulk of your first 2 years. Third and fourth year of the physio degree are completely different. But any of those degrees, you should be fairly safe in terms of transferring with your credit points.
Okay, great. Just another question. How many positions in the course do you offer each year?
So basically, we offer around 100 student space, but so it really depends because it is related to the UAC admissions criteria. So the total students per cohort can be up to 120 to even 140. So depending how many internal transfer students we have.
Yeah, okay. Follow-up question from Bridget again. So just if someone did complete their sports and exercise science degree, are there postgraduate options available and which they can obviously go on to work as a physiotherapist?
So it depends how long has the students been graduate. Because for what Rocco has mentioned about the advanced standing, so there's like a time limit. So according to the university guidelines, so the time limit will be 2 years. So that means if the student has graduated for more than two years, and they have to go through all the foundation units for the first and second year. So regarding the postgraduate course eligible for physio registration, I assume. So we don't provide any postgraduate entry course from our school, but we do offer postgraduate training, such as Master in Health Sciences. And obviously we welcome postgraduate research student like Master in Research and PhD.
Okay, great. So we just got a question from Mark regarding mature age students. So mature age students is a term that was used maybe 3 years ago before it changed to a non-current school leaver. And just to clarify for anyone out there who may be thinking about this. So previously a mature age student was anyone applying to university over the age of 21. Now the criteria for a non-current school leaver is not being in school for 6 months and over the age of 18. So what that means is you can apply to courses at Western Sydney University based on other things besides your ATAR. So if you're a current school leaver, meaning you've just completed the HSC, for that 6-month period thereafter, you can only use your ATAR to apply to university. Thereafter, we can look at other things like work experience, previous qualifications you may have done during school, and things like that. They translate a little differently to an admission rank. And if you want to chat to someone about what you've done in the past or your work experience or what you could do to get a higher admission rank to get into courses like physiotherapy, because they are quite competitive, you can definitely chat to us online today and we can give you more of a clearer understanding about what that is. Question here from Lauren. So do you have any early entry options available for students who are in year 11 or 12? Also, are there any ways that applicants can receive bonus points?
So we used to offer bonus points based on area and your subject specific performance, but we don't actually offer them anymore. So it's kind of a cut ATAR. So yeah, no bonus points for physiotherapy anymore. And that's owing to how popular the course is. So we kind of needed to take a cut off at some point. What was the first portion, sorry, about the...
do you have any early entry options available for students?
I don't think so. So you can check the True Rewards pathway and the Year 11 pathway, but I don't believe that we offer that anymore through physiotherapy.
Yeah, I can confirm that's no longer, or it's not ever been offered through HSC True Awards. If you do want to look at early option pathways, what I would advise is you use that program to get a guaranteed offer or secure your spot in a course like health science. And then if you accept with the HSC True Award program, you have to accept that offer by a certain date. But if you move that course that you've just received an offer for completely out of your preference list and get rid of it, what that means is you can get future offers in future rounds for courses like physiotherapy. So just to confirm what I'm saying here, if you got an offer for health science, you can still use your ATAR that you get later to apply for physiotherapy. So I definitely advise applicants take advantage of that program. Just having a look at the next one. Oh, this is a great question I was about to ask myself. So what is the lowest ATAR that you're currently taking for physiotherapy?
The cutoff for the most recent cohort is 95.
95.
Yeah, so that if you're a high school leaver, it'd be 95. But like you said, if you aren't successful in getting the ATAR or you just miss out, you can go via those alternate pathways.
Yeah.
Yeah, and actually the score cutoff for the past 3 to 5 years are pretty stable. So I would say 95 would be a very good reference.
Yeah.
Because nobody knows the ATAR score cutoff this year, but I mean, so that would be a very good reference for the candidates. Okay,
just going back to that. So you previously said you needed a distinction average for a GPA to transfer in. So that's a 6 on a 7-point scale. Is that still the case, do you think?
Like Roy said, it's kind of a good yardstick. So historically, if you're around that area, you're in a good position. Some years it's been slightly lower, some years it's been slightly higher. It kind of just depends on how many applicants there are that year and how they've performed. But I think if you wanted a loose target, 6 is a good target to have. But yeah, there aren't any guarantees because it may fluctuate year to year.
Yeah. Okay. So just a question from Judy that's just come in. So are there any prerequisites for physiotherapy?
Not really. So basically I'm talking about the school leavers, so who is not, having an internal transfer. So basically our curriculum covers all the requirement from the registration body. So basically we don't require any prerequisite for that.
Okay, great. So we have another question from Judy. So is the university currently being more lenient with admissions based on the current situation regarding coronavirus pandemic? I guess you'd still have such a high amount of applicants, so that line in the sand would always have to be drawn, I guess.
Yeah, actually, you know what, in my opinion, I would foresee the competition will be even more keen because of COVID, or even, people are more aware of the importance of, the medical professionals. And that's why maybe more youngsters would, want to be one of them. And that's why I foresee the competition will be even more keen instead of, the admission criteria being more lenient. It may be the other way around, I would say.
Good answer. I agree.
I think across the uni, though, there's been a lot of understanding with the current situation. So in terms of your advanced standing applications, in terms of applying for rule waivers or leniency with grading, things like that, I think the university response has been really good. But yeah, I agree with Roy, because health is going to get such a big push this year. It's probably going to be a bit more competitive to get in the first instance.
Yep.
Yeah, definitely. So we have a question here about GPA conversion. I can probably answer it. So the question was, what percentage conversion for a GPA of 5? So a GPA of 5 is a credit, and a credit score is 65 to 75 out of 100. So just to ballpark that for you. I really like this question that's just coming from Jasmine. You mentioned that the course was very competitive. What is it about this course that makes it so popular? So you kind of just partially answered that, but I like where this question comes from. So what makes this course so great, or why is it so sought after?
I might start and you can jump in if that's okay, Roy.
Sure.
So I actually did this degree. So my undergrad was in physiotherapy at Western Sydney. And then I decided to do PhD here, and now I'm a lecturer here. So
Out of the furniture, can't get rid of you.
can't get rid of me. But it is a testament to how much I enjoyed the course, I guess. There's a few things. I think, like Roy said, one is 100 in the grand scheme of things for a cohort, or even 120, 130, is not really like what you see at the mega massive courses for physiotherapy. So some degrees you're getting close to 200 students. And what I really enjoyed about the course was, and this is still the case, you can go up to any of your academics, have a chat. We all know your name. You know, our doors are always open. So we have that really nice, tight-knit community, which I think is popular among students because you can consistently get that feedback. You never really just feel like a number or, you know, a student ID. You feel like a person, and you're actually appreciated for your input. And I think that was massive for me. Another pull, I think, like Roy mentioned, is that we do tailor for the Western Sydney area. So if you're interested in working in that area, we're the best. And because just we're specifically tailoring to your placements, you'll be working in the Southwestern Sydney local health districts in those hospital areas, which is really good. One thing I think that also sets us apart is we're the only university in New South Wales that actually has an embedded pediatrics placement. So if you're interested in working with kids or getting experience in that kind of combined holistic area of pediatrics, we're actually the only one that offers that pathway. So you do a 5-week placement at somewhere like Westmead Children's Hospital, and you do that off the back of a pediatric unit. So you've got quite a lot of flexibility. You get broad exposure to things like intensive care units, obviously sports physiotherapy, pediatrics, neurological. So I think the combination of that tight community plus the exposure to the Western Sydney community is really, really handy. And I think that probably contributes to the popularity.
Yeah, maybe I just add one more point here, because I just gone through very recent surveys among the employers of our graduates. And I would say they really like our graduates. So I would say it is partly because our strong bonding with the clinical partners. So we have regular meetings with the clinicians, frontline clinicians, such that we know each other well. And that's why, you know, we run the, you know, review and we run the curriculum regularly, such as to meet the, you know, clinical needs. For example, you know, very recently, you know, tele-rehab or telehealth is a hot topic, right? And, you know, we embed this component, this element in one of our units, you know, and I see the students really enjoy it. So I think we are very reactive. We are, you know, we take the advantage of being, you know, like a small boutique like courses. So as Rocco said, we have very close relationship with our students, such that we are not perfect. So basically, when the students encounter any difficulties, so we are the one to try to solve them out together.
Yeah, absolutely.
Okay, so we've got another question from Judy, and I think you partially answered it there, but I will ask it just so you can dive into it a bit more, I think. So what makes our program here at Western Sydney University different from other universities? So you've talked, or I think you've half answered that question already, but I'll still give you the opportunity to answer it more specifically about how it's different to other universities.
Yeah, so I think, like I said, the course size is a big factor. So that the fact that we can have that communication and that link with our students. And like Roy said, that relationship is really important. Definitely the pediatrics component, we're the only ones who offer that as an embedded placement. I think that's really important as well. And yeah, the Southwest Sydney local area, I think it's those kind of, I guess, the components that make us unique from the previous question are very similar to the ones that kind of separate us from the other competing universities.
Yeah, great. So I'm just going to answer Hannah's question here, because we've already answered it previously. So Hannah's asked again, are there any particular subjects that they need to complete in year 11 for early entry and things like that? So there are no prerequisites, Hannah. The whole premise of applying off an admission rank out of 100 is you do the subjects that you think you'll enjoy because you normally perform better in those subjects. So yeah, so there's no prerequisites for the course. Going on to Mark's question now. So is it possible to chat one-on-one with lecturers before applying? So Mark, so that normally is available during our open day. However, since it's online this year, the way to chat to them one-on-one is through this forum that we're having now. So you can ask questions and they can answer them for you. So if you do have any specific questions, Mark, feel free to pop them up and we can go over that now. Next question. If you have an ATAR above 95, but a low GPA with your uni, will your GPA significantly affect your chances of transferring in?
Oh, it depends. So
I feel like I could answer this question, but you go first.
No, I was just going to say, I think it would depend on when you got your ATAR and when your most recent course of study actually was. But yeah, if you want to add to that, go ahead. Yeah,
so your ATAR never expires. So if you had got an ATAR 90 years ago and it was 99, you could still use that. They don't expire. When it comes to your low GPA, with our courses, except one, but I won't name it because it's not this one, we accept your highest admission rank. So if you submit 10 things to us that you've done, like different degrees, we don't add all those things up to give you an admission rank. We look at them all individually and we take the highest one. So technically you could still apply off your ATAR. When you do make an application, we look at what you tell us. So if you don't talk about your low GPA, but we won't go looking for it. So just letting you know that. Another question here is how is your physio course compared to WA physio courses? So we're in Western Australia. I couldn't imagine they're very different because they've got the same accreditation, but what do you gentlemen think?
I think similar in terms of, in Australia, you do have to meet certain requirements to be a physiotherapist. Different though, in terms of the target demographic. So Western Sydney is a culturally and linguistically diverse area. So obviously we integrate that into our curriculum. So you're going to, I think the courses themselves in terms of you're going to be learning anatomy, you're going to be learning biomechanics, you're going to be learning the areas of physio will be similar. But there'll be a slight bent, and this is for any degree, depending on where the course is actually delivered, I think. Is there anything you'd add to that, Roy? Or?
Yeah, so far I'm happy with that.
Yeah.
Okay, so I've just thought of a question while you were talking in the last 5 minutes. So with your university placements, so do students have to organise them themselves or does the university admin staff organise that? How does that work?
Yeah, so basically there are a total of 5 placement blocks. So first of the first one actually I'm taking at the 3rd year of the program, and that placement we call it general. So it is more like an overview of the clinical environment, such that the students would be able to experience or explore whether they are doing, so they try to immerse themselves into the clinical environment. And the other 4 would be like specialty specific, like the orthopedics orientated, pediatrics, the one Rocco mentioned, neurological, as well as MCAS, so NAQ. So basically we cover all the major areas that usually a graduate will work in the clinical settings, and we will arrange the placement for the students. Unlike, because I study in the States, so students from USA, I would say half of the physio school, they have to arrange their placements themselves. So, but we do it for the students here. So no worries about that.
Yeah, nobody has to organise their own placements here.
Mm.
Okay, we just got another question I'll quickly jump to because it's relevant to the topic we're talking about now.
Yeah.
So do the placements have to be in Sydney or can they be in regional areas? Or yeah.
Yep. So usually we do our best to try and place students at facilities that are within 2 hours of their home. Or I think it's like 70K, so even slightly less than that. But usually you get the 2 or 3 hospitals closest to where you live is usually how we do it. We are starting to, and we have this year and last year introduced a couple of rural placements. So there are opportunities to do that if you're interested. But for the most part, if you're not interested in that, we're not going to send you to Walgett if you live in Wollongong. Yeah.
And also, actually, of course, it is affected by COVID nowadays, but we are going to increase the quota for the international placements as well. Especially students would take this chance to explore different medical systems. But definitely, the competition will be very keen, for the selection. But because of COVID, obviously, it has been put on hold for now. Hopefully, next year or the year after, everything's resume normal. I hope. Fingers crossed.
Hopefully, yeah.
Yeah.
Fingers and toes crossed. How many hours do students have to do of placement in total?
So they do 5 blocks of placement. So they'll, like Roy said, they'll do their general ambulatory care, which is kind of like similar to a private practice, outpatient type setting. They'll have an acute one, they'll have a pediatrics one, and they'll have a rehab one, sort of with a neurological focus. Each of them is 5 weeks, and they're from 9 to 5. So whatever that works out to be, but it's basically full time for those placements. You do four of those 5-week blocks, so 20 weeks in your last year, and then in your third year you do 5 weeks.
Okay, great. And the ATAR is the same for regional and metropolitan students, is that correct?
Yeah, there's no, I don't think there's any alternate pathways or bonus points or anything.
Okay, great. And what campus is all this offered through again? Sorry?
Campbelltown.
You can see it in the background.
Yeah, my background is the entrance of the Campbelltown campus. It's beautiful.
Okay, we've got another question regarding hours. So how many contact hours are there per week for this course? So how many hours of lectures in total on average, would you say?
It varies. So usually, and so basically you'll have a 2-hour lecture for each unit, and then a 1 to 2 hour tutorial. And each semester you'll do 4 units. But with all of the degrees at Western Sydney, it's based on your credit points. So there is kind of an expectation, if you're doing it full time, which it is a full-time degree, you'll be putting 30 hours in each week. But that's not all contact. So it'll usually be 8 hours of lectures per semester, and then kind of 4 to 8 hours of tutorials. So that's the face-to-face component. But you want to be at least matching that in terms of your independent learning. So at uni, a big focus is on what you learn from home, because a lot of the tutorials, so the classes and the lectures, are based on what you've done independently.
Yeah, and I would say it is actually not related to COVID, but I would say because of the nature of the course. So, you expect a lot of hands-on or like polishing of the menu skills. And that's why a lot of educators in physio school, we try to maximize the contact, contact hours with the students. And that's why many of the physio school, we are one of us, we employ like a blended learning approach. That's it. We just put, on materials online such that the students would be able to prepare before the actual practical sessions, to, better utilize the time. And that's what is really tricky to quantify the numbers of contact hours here, I would say.
Yeah, because
from Talia, and I was literally about to ask that. So how many days a week on average do you think a student would attend?
It will vary again. So in your first couple of years when you're doing the common units, it depends. With Western Sydney, your timetable registration will be online. So assuming that you log in at the right time and you get a decent tutorial allocation, I would say first year, usually kind of 3 days, 2 days if you're very lucky and you get a very condensed timetable, but around 3 days in your first 2 years is not uncommon. Third year, you're pretty much here 4 days face-to-face, and then you may get 1 day from home, but again, you're doing your independent learning and your group work and your assignments, and your assignments during that day. And then the last year, the expectation is you'll be working pretty much full time because you've got those 5-week placements.
Mm.
Yeah. So kind of the amount you're here or the amount you're required to dedicate in terms of face-to-face hours will kind of increase as you go.
Okay, great. We just had a question about facilities. So I think the question specifically was at our Parramatta campus, but you're located at our Campbelltown campus. So are you able to talk about the facilities that are there?
Yeah, do you want to start, Roy?
Oh, sure. So actually, we have a pretty spacious teaching labs, as well as some research labs as well. But we not only use the research equipment for research. So we, at the same time, we try to increase the exposure of the students, because nowadays a lot of clinical practice, they also make good use of the technology to facilitate the practice. Actually, I was born and raised in Hong Kong, and when compared with the space, so here is really luxurious. So just like the class I had yesterday, so we had about 20 students, and I think we can actually double the class size if I were teaching in Hong Kong.
Wow.
Yeah.
Yeah, I think in terms of the lab sizes, they're very big. We've got, walking tracks. We've got heaps of basically anything you would need in terms of equipment, education, we have it. So I'm assuming you're coming from the undergraduate perspective. So we've got things that will kind of set us apart, though, will be each person will get a lot of the time their own equipment. So if you're doing cardiorespiratory, you'll get your own devices to practice with. We've got a lot of simulation equipment, which we've started using. So I teach some of the intensive care unit scenarios, and we'll have things like roboticized mannequins. So kind of, robots that come in and they can cough, and you can listen to their chest, and you can assess and see them breathe and do potentially more invasive things in terms of assessment and treatment, which you guys probably don't even know physios do yet. But we do work in intensive care, which is pretty cool. So you get to practice in that kind of low stress environment with the mannequin, which is handy, because I think initially, when I went through, originally, we didn't have a lot of that kind of simulation equipment. And this is pretty consistent across a lot of the degrees, where you'll get taught something theoretically and then you're expected to do it on your placement. But there's not really a lot of stuff like that with us. Like, we try our best to give you the exposure, at least to some degree, in class. That way you're prepared when you go on placement.
Yeah, great. So just to confirm, so it's a 4-year course. We've just got a few questions that we've already answered, so I'll just confirm them. So it's a 4-year course offered at our Campbelltown campus. Can it be is it offered part-time or just full-time?
Just full-time.
Yeah, just full-time. Yeah,
Okay.
if you have alternate arrangements, so if you're part of the elite sportsman program, there are a couple of very small exceptions, but it's full-time.
Right. Now, I really like this question. So what core competencies or specific traits should someone have or work on in order to succeed in the course?
I feel like if you're asking that question, you're going to succeed.
Yes. I like that answer.
Yeah, it's a great question. I'll list a couple. I'm sure Roy will add to it as well. I think work on your communication is huge. So physios spend a lot of time talking and listening to the people they're working with. As a general trait, you want to be empathetic. So you want to understand people's scenario. You're going to be working with people who are very sick or people who are in pain. So you kind of got to take that on board and reflect that empathy and that compassion in your practice. What would you say, Roy?
I would say the opportunities being a physio graduate is far more than just being the clinicians. Because I have friends who graduate from a physio degree who turns up to be a scientist, or like industry, researchers in the industry, or even like the NGO CEO or entrepreneurship. So I think there are lots of opportunities, and I would say the attributes or the traits are quite different across the different roles. But I think what Rocco's mentioned are more about the clinician specific trails. But I would say it also depends on which area you're working in. For example, if you're working in a pediatrics settings, so probably you also have to handle, good at handling kids, or communicate with the parents. So basically, it is a caring heart, very full of empathy, because we are treating human. Communication skill for sure. And analytic skills as well.
Yeah, that's a good point. So clinical reasoning and your critical thinking becomes huge. So trying to be objective in your approach and not be too biased or let preconceived ideas influence your decision making, which is something you learn at uni. But that's a huge one.
Because we usually work even though you're a clinician, so I mean, you always work with the medical teams, like medical doctors, nurses, OTs, all medical professionals, and we make decisions together. And that's why that would be a very important attribute for being good at analytics.
Yeah, for sure.
Yeah, I really like those answers. Just one more, and again, I feel like you've just touched on it, but I'm going to ask the question. So what are the different career pathways? So I guess there's public and private practice, but can you go into those a bit more?
Sure. I would say a lot of physio school graduates, they were just joining as a clinicians because they're eligible to register as a PT for sure. So I would say local hospitals, clinics, so even elders home. And I see a lot of opportunities for home care, because the world is aging. And I foresee the demand would be huge for geriatrics care. The other thing is the primary health care. So prevention is better than cure, right? And that's why I also see a lot of opportunities exploring that area. What else, Rocco?
Yeah, well, we're lucky, I think, in Australia, because we are primary contact clinicians. So like you said, Brandon, we've got private practice. So that means you can set up your own practice. You can have people working with or for you in that environment, which is handy. Roy kind of touched on the public component, which is working in a hospital, which is a little bit different. Other things, you can go into research, like Roy said. So you might pursue a PhD. You might look into treating conditions more broadly, or assessment strategies, or prevention, and it's quite broad. So Roy looks at biomechanics and develops, it's got kind of an engineering bent, and my area is non-invasive brain stimulation. So once you get into physio, you realize, okay, this is actually a ticket to a lot more than what I probably thought it was coming in. Governance, like Roy said, so you might work with local governments or state governments to change health policies or contribute to reform. So yeah, basically anything you can think of in the area of health, physio is a really good gateway. The only one we probably didn't touch on is the academic component. So obviously Roy and I teach, so that's another pathway you can take if that's something you're interested in.
And I know a lot of the students, they really want to be the on-field physio, like the physio or for Roger Federer.
Yep.
Or Cristiano Ronaldo. Yeah, so that can be possible.
Yep.
Someone's got to do it. Just going on to a few more questions now. So Charlie's asked a question about how enjoyable is the course. So he specifically said, how enjoyable have you found this course, and which specific classes / areas of physio have you found the most interesting? I guess since you're academics, you could see one side of the coin, but in the student surveys and everything, what are some common themes that come up?
Yeah, it's a good question. So I can speak from the student's perspective as well, because I did it. So the experience is fantastic. I wouldn't work here unless I had a really, really good undergraduate experience. So I can't speak highly of the degree itself enough. The staff are really friendly. The courses are really enjoyable. Obviously, I won't like narrow in on specific units, but there's no poor ones, if that's kind of what, there's no downside, there's no veggie subjects. Everything is kind of useful. So, but they all build on each other. In the first year, you learn about your communication, your anatomy, your biomechanics, that foundational information. Things I really enjoyed from there were getting into the anatomy labs and working with specimens, seeing, brains in real time, holding them, looking at how they work, looking at the anatomy of that was really, really interesting. And then you kind of transition into some of your more physio-specific skills. So the hands-on is really fun, really enjoyable. Like you actually feel like a physio by the time you graduate, which is great. Obviously, I teach a lot of the acute care stuff, so I really enjoyed working with the simulated scenarios and learning stuff outside of what I thought physio was. I can't speak highly enough of the degree, and I really enjoyed all of it. But I think the thing I probably enjoyed most were the placements. So you've got this fantastic orientation. You're in the lab, you're working with specimens, which is great. Then you have this hands-on, which is a completely new experience. And then you're on placement, you are a physiotherapist, you have that autonomy. It's awesome. It's fantastic.
Yeah, I would say the most enjoyable moment would be the one you see the improvement from your patients. But whether you feel it is enjoyable, it also depends on whether you fit into this program or even career. Because I did come across students who, pick physio as, degree for the uni study based on, for example, to fulfill parents' wish. Just listen to yourself whether you really enjoy this program. And I do believe if you fit into that career, because medical profession, not only physio, but medical professionals are quite special. Yeah, we are somewhat silly in some sense because we don't really count for the efforts and return. Otherwise, we would do business. No, sorry. Yeah, but I mean, this is really meaningful, but I mean intangible to see your patients. So I still remember the first time I helped stroke survivors to be able to walk again, and how not only the patient but their families, how they're so thankful about our effort. So I think that is really unforgettable, basically.
Yeah, absolutely.
What an amazing moment. Like there are some healthcare professions that only deal with the acute emergency or something else, and they don't actually get to see the full transition.
Yeah.
So I guess in physiotherapy, you get to see the full journey.
Yeah.
And you've given some really good advice there. If you're doing this for someone else, well, 4 years of your life is a lot.
Yeah. I would say only do it if it is your passion and it is something you genuinely want to do. I think the only exception to that pathway, like I was talking about how fantastic it is, I agree with Roy. If it's something where your heart isn't in, you won't enjoy it. And that goes for anything. So when you are picking a degree, pick it because it's something you think you're going to love rather than someone else's expectations or the unfortunate throwaway I think I can foresee is people saying, oh, I did it because I got the mark. Just because you get the mark doesn't mean you have to go for, you know, a 95 plus degree. Like if you get a 99 ATAR, but your passion is something that has a 75 ATAR, do the 75, go with your passion. Don't necessarily just go with the expectation.
Yeah, I couldn't agree more with that. I'm a little bit younger than you two gentlemen, so I could probably say this. But, you know, I graduated high school a few years ago, and there's so much emphasis of always trying to do not the best, but the best of whatever someone else's ideal is. But do what you think you're going to want to do for the rest of your life, because you've only got one life. You need to live it well, not unhappy. So just moving on from this course of questions that we've just been going on about, just to answer Kate's quick question. So no, you don't need to sit the UMAT for this course. And thank you, Charlie, for answering that one. And he was correct, it's only for medicine and dentistry, for undergraduate courses. Another question is, so for year 12 students who haven't done any science subjects and never really shown any interest in science previously, how heavy is that science component of the course in going into a university degree, which is, you know, a healthcare science degree?
It depends. So the first, when you're learning your foundational stuff, there is a little bit of science in there. You do cover things like physics because you learn biomechanics, and it's important to understand how the body moves and how it reacts to different circumstances. Obviously there's a big biology component, so you learn a lot of your human anatomy, a lot of your physiology. But like Roy said, there's no expectation that you're coming in with that knowledge. So on the course website, you know, the only prerequisite I'll say is English, which everyone has to do. So the 2 units of English. And there's a recommendation that you do biology, but it's definitely not an expectation. So you do learn everything you need throughout the degree. I think the key bit in there, though, is like we were talking about before. If you haven't shown an interest in that area, think about where your interest lies. So if it's not the sciencey bit, is it in the helping people? And if so, absolutely. But if it's something you're not interested in, then maybe consider pursuing something where your heart is in it more. But if you do want to help people and science isn't your thing, do not stress out. We do step you through that. Like, it's a linear degree and you learn everything you need as you go.
Great. So, yeah, and I study obviously at Western Sydney University. I don't study physio, but I do a science course, and I never did science in high school at all. And I'm, you know, in my 4th year now. So like, whatever you need to know, the university will teach you. I can definitely preach that.
Yeah.
So just to confirm for Chloe, there's about 100 spots per year for this course, give or take. Elizabeth just wants to know, and I think we've touched on it a few times, where will we work, in different clinics or universities? So I think Chloe's talking about placements there. So do you always do the placement at the same area, or do you swap around to clinics, hospitals and things like that?
You can take that, Roy.
Actually, as I mentioned, so we have a series of placement and we try to maximize the exposure for the students. So basically for each student, so they will be allocated into different hospitals, clinics, different settings. So even for the same hospital, so they will be having like, you know, clinical placement in a completely different area. So for example, one may go to acute setting working at the ICU or the surgical medical wards, and maybe the second time to go to the same, for the same hospital, they treat different kinds of patients, like patients following orthopedic surgery, for example. So I would say, so we try to maximize the exposure according to the specialty rather than the, you know, clinical units. So even though, having said that, so we actually provide a pretty comprehensive list. So we work with, you know, a numbers of clinical partners. So they are local health district hospitals, as well as clinics and schools, and as well pediatric centers, so on and so forth. Yeah.
Great. I just want to confirm for everyone as well, since there are a few questions keep coming in about the Parramatta campus. So it's a 4-year full-time degree at our Campbelltown campus.
Yes.
The Campbelltown campus is very accessible. There's quite a lot of parking there compared to said Parramatta. And there's a train station 5 minutes away. So it's very accessible, to just confirm that. And I really appreciate everyone answering other people's questions in the chat as well. If I don't correct anything, which I haven't so far, it's because everything that people have been replying is the correct information. So thank you everyone for that. Just a question now about going back to the sciences and things like that. So is chemistry a big part of the course, or is it more, what kind of science-based is the course, I guess?
As mentioned by Rocco, I would say biology and physics may be the two major components that really relates it to the curriculum. But you know, it is like a recommended experience instead of like a mandatory prerequisite. Yeah, so I would say chemistry, the linkage may not be as strong as physics and biology.
Yeah, agreed.
Great. So 100 spots in the course, you know, give or take a bit. So, but how many people apply? Because if we've got a question here, do most people who apply get into the course? Well, being so competitive, I'd imagine not. But do you know the numbers of how many people apply?
Very broadly, the answer to that is, when we say it's competitive, it is competitive. So even though we have 100 people get in, it's not unusual to have close to, you know, the thousands in terms of applicants. So if you are lucky enough to get into physio, you're in a very small minority of the people that actually applied.
Okay, and there's no interview part of the process for any of that, is there?
No interview.
Okay, based on the raw mark. Okay, just getting a few more questions about people wanting to book specific appointments with course advisors and things. So the advice that I'd give to people is to chat with our online team that's at the moment. I think they'll be popping up every now and then, and they can chat to you, and they can answer all your personal questions and things like that. And if anything is not answerable, they have contacts to answer that, so they can definitely help you with that. Just going through the questions, I think we've answered most of them, but guys, if you have any more, please send them through. We've still got a little bit of time up our sleeves. There's another question here. So is there a humanities aspect of the course, or is it just purely science?
No, there are definitely humanity components. So communication's a big part. Verbal expression is probably the heaviest kind of humanities-based component. But there are expectations in terms of your writing. So you'll be doing essays, you'll be doing presentations because of the communication expectation. So it's not a humanities degree by any means, but there are definitely humanities-based influences. So you're not going to be doing history, but you will be doing things like communication, essay writing, presentations, stuff like that.
Just thinking, because you talked about essay writing, how is the course assessed? So is it more, you know, essays and you get marks on that, or is it end of term exams, or is it like practical OSCEs or things like that? So how is the course assessed?
So it really depends on the learning objectives of each subject, each unit, I would say. So for example, if that particular unit really want to strengthen or, you know, enhance the menu skills, so obviously the practical exam will weight the most marks of that unit. But for some foundation subjects, units like biomechanics or physiology, so you would expect a lot of like written exams or essays, types of assessments item. So it varies a lot, I would say. But the general trend would be more writing or more like written assignment would be at the earlier of the program, while the later phase, like the clinical placements, the practical driven units, so they are mainly about the practical skills.
Great. So we don't have any more questions right this very moment. but I've got some extra questions here that I've been writing down during the session that I might ask. So I think we said it really early on, but just to go back, because I have written it down and I haven't ticked it off that I've asked it. So what was the accreditation that someone gets at the end of this 4-year degree?
You can take that, Roy, if you want.
Yeah, so basically, for the students who complete the program, so basically we will just provide the information to the registration body called APRA, and basically, so assuming the students has passed all the clinical placements, all the units required, and one more thing. So it is about the language requirements. So our professional registration body require basically for international students. With the IELTS score of 7, with a sub-score of 7 as well, and they will just automatically eligible for the registration.
Yeah, great. So just to anyone who wants really specific questions answered about what they or someone else have studied and what they can do to get into the course and things like that, definitely chat to us online or give us a call, because they can answer your question specifically. Abby's just asked a question here, and I'll be really interested to know this answer, but are the cohorts male dominated, or what's the distribution there?
No, so interestingly, physiotherapy is actually a female-dominated profession. It has shifted a lot lately in the last few years. It used to be 70-30 female to male, and now the ratio is about 60 female to 40% male. Yeah, so it's more even split now, but it's slightly on the more female than male side.
Okay, that's interesting to know. And just going back to another question that we've already talked about bonus points, so that there aren't bonus points available for this course, just because it's such a competitive course. And also to answer these questions, so there are no prerequisites either to get into the course. You just need to do as best you can in that, your high school studies and things like that, to get the best mark possible. In the past, Emery is just asking a question here about, are you able to give a ballpark figure about how many people are successful in transferring into physio from health science?
Not really. So it varies. It varies a lot. Like I said, the GPA cutoff of 6 is pretty good. It used to, like 3 or 4 years ago, the success rate was very small in terms of transfers. So we might have had 5 per cohort. Lately, it has increased a bit. So we have more internal transfers. But yeah, it really depends on the climate of that individual year and that individual cohort.
Okay, that's fair. So just to confirm, so with non-current school leavers, high school leavers and transfers, it's just a matter of everyone applying and you taking the highest ranked applicants. Is that correct?
Yeah.
Okay, that's what I thought. Just letting everyone know, we're going to wrap this session up pretty soon. So if you have any more questions, please get them in as soon as possible. But yeah, just a follow-up question to that. How many is more than 5 or 10? I think this person's seeking a specific number. I guess it's hard to say because it would change every year. Is that right?
Yeah. So think of it more like a percentage, right? So if I would say if only 10% of applicants are successful, however many get in really depends on how many apply. So if 100 people apply, we may end up taking a couple more just because you've got more people who are going to be above that cutoff. But if one year you luck out and not many people apply at all, you have a better chance of getting in. So it scales. Think of it like a 10 to 15%, but it really depends on how many people apply in terms of how many actually get in.
Yeah. Just a few more questions that we've already discussed. And while I'm just doing a few things on my end to wrap things up, I might get you to talk about it again, if that's all right. And sorry for the people who have been on here since the start. They probably sound like a broken record by now to you. But what are the courses that they can do to transfer into physio? Are you able just to go over that again for us, please?
Yep. So you can do health science because that has the same common units. So your first 2 years are very similar to physio. So you can get advanced standing for those and transfer. Very similar for podiatry. So you cover your professional health competencies, communication, anatomy, same as for podiatry, occupational therapy, some sport and exercise science as well. So if you go with health science, podiatry, OT, sport and exercise science, or paramedicine, you should be quite safe. 90+% of the units you do, if you do it at Western Sydney, you will get advanced standing for, and you can transfer from them into physio. The only thing we kind of emphasized before is don't just start a degree because you want to transfer into physio. Make sure it's something that you're passionate about and that you love, just in case you don't get a successful transfer. All of those are still really great degrees. If you want to go into one of them, make sure it's the one that you're like, okay, look, in the back of my mind, yep, I'd like to do physio, but if I'm not successful, I would still love doing whatever other degree it is. The only thing I'll add to there, which we didn't mention, is all of those in your first 2 years, all of those degrees actually work together. So like Roy said, a big part of working as a physio is working in those multidisciplinary teams. So working with podiatrists, nurses, occupational therapists, etc. So your first 2 years, you do units with those other professions and learn with them, which is a really unique and good experience. You're on mute, Brandon.
Thanks for that. Another question that we have, and I'd be really interested to know your answer to this. So what are the benefits of doing a physio degree over medicine?
Do you want to start, Roy, or do you want me to start?
Wow, it's a tough one. I would say, at least in short term, so most physio position, we don't have to work night shift. So that is one of the major difference. What else? Benefits?
It kind of depends on your personality, I think. So if you're someone who wants to develop that rapport and have that one-to-one interaction and spend more time with your patients and iterate on your treatments, then I think physio is definitely advantageous. So the unfortunate thing with medicine now, I think, is because of the expectation, you might have a patient, they come in, you spend 5 minutes with them, prescribe some medication, then they leave. Whereas physio, it's someone who's coming in a lot of the time with a chronic issue, or you've seen them, you've diagnosed them, they come in, you refine your treatment over time. So I think if you want to get to know your patients and develop rapport and work on that, I think physio is definitely an advantage. In terms of the alternate pathways, so the research routes are pretty similar. You can go into similar academic routes, you can go into similar research routes, similar governance roles. The hospital-based positions are different, obviously. You'll be working as a physio or as a medical professional, but yeah, I think it depends on you, I think. So it's a hard question to answer because for me, we did physio, and when I went through, it was actually the same ATAR requirement as medicine. And for me, a big thing I wanted to emphasize was that rapport building and really seeing over time, like Roy said, this person came in and, had a stroke, or they've had a traumatic brain injury, they can't walk. We are there every step of the way to see them on their journey to improvement. Whereas I think, unfortunately, medical professionals will see the snapshot at the start. They may get a bit at the middle and a bit at the end, but they don't actually get to witness the whole journey. But it depends on what you're interested in, I think, would be the takeaway.
Yeah, good answers. But I actually read that question wrong. It was, would doing a physio degree benefit my chance into getting into medicine? However, I feel like that question is more suited to be asked tomorrow at the medicine session. But quickly, that's a 9 years of study in total. Yeah. So just another question. How many people get into the course based on their ATAR? I guess...
As opposed to like internal transfers versus...
Yeah, I guess that's what they're asking, but I feel like we've already answered that question based on what we've previously discussed. Sorry, I just read that question for the first time as I asked it. All right, guys, we probably might start wrapping up. I'll give everyone a few more seconds to ask some last minute questions. But Roy and Rocco, is there anything else you'd like to discuss before we wrap this one up?
Yeah, maybe I try to address the last question a little bit for my wrap up. I would say it is really, I would say actually it is difficult and also somewhat inappropriate to compare two different professions, because it is like orange versus apple. And also the work benefits confuse a lot for me, because it is a different job nature. And that's why, as I said before, you really have to understand yourself. What is your career goal, or what would be your characteristics about things like your value. So because people may see being a snapshot as a medical doctor as a benefit instead of a disadvantage. So it really depends on your own value. So I would advise the students, especially for those school leavers, to really think about what they really want to do in their career.
It hit me a little bit like awkwardly initially at first, because I heard that as two different professions. So just to elaborate on what Roy's saying, like if you said to us, what would be have more benefit, being a physiotherapist or being a gardener? I don't know. If you like gardening, be a gardener. If you like physiotherapy, be a physiotherapist. And I think the same thing goes for medicine, same thing goes for nursing, same thing goes for teaching. Go with what you're interested in and what you're passionate about. The benefit, I'm assuming you're talking about pay, which is one component, but there's a lot of other stuff you can take out of a profession. Like do what your heart lies with and what you'll enjoy. Because at the end of the day, hating your job and earning X amount of money is not going to make you happy. Whereas if you have a job that makes you happy, that's going to do a lot more for you, longer term.
Agree.
Yeah. Just to answer Talia's question here, everyone. So what happens if over 100, 120 people apply with an ATAR over 95? Do they all get in? So the advised ATAR of 95 is the lowest cutoff for the previous year. So if, hypothetically, 100 people apply with an ATAR of 98, well, the ATAR would obviously go up for that year. So the publicised ATAR is the last cutoff for the previous admission round, which is every March. There's no mid-year intake for this course.
Yeah.
So it's always the last year. Alana's just asked a question. Are the first year of physio and the first year of sports medicine similar degrees?
And so the first year of sport and exercise science, the first year of health science, and the first year of physio are very similar. If you're going for something 1-to-1 equal, health science is pretty much identical.
Great. We don't have any more questions coming in. So Rocco, if you want to do your wrap up.
Yep. So I will just say, just for your reference, guys, I teach the acute care units, but I'm also the course advisor. So you'll be chatting to me in terms of, your progression throughout the degree when you get in. If you do have any questions, just, like Brandon was saying, pop it in the chat, discuss it with our team. We're also willing to, have a chat if you would like. But a lot of the information you need is on the website, and the guys who are running the open day are absolutely awesome. Like I said, I went to Western Sydney and did my physio degree here and absolutely loved it. Honestly, one of the best experiences of my life. So if you are passionate about physio and it is where your heart lies, absolutely go for it. But make sure it is what you want to do before you apply.
I really like that advice, and I think I've said that already today. Do what you want to do. Don't do what someone else
Yeah.
think you should do, or you think you should do just because you could do it, like you got the ATAR high enough?
Mm.
If I transfer from health science into physio after a year because I didn't get high enough ATAR, would I be very disadvantaged?
No, so if you have a high enough GPA, so you do a year of health science, and you get, distinction average or better, so, getting 75 plus, you're not disadvantaged in any way. So you won't have missed any of your units. You'll be doing the same units with the physios anyway. So you'll still make the same friends, you'll still do the same classes. So yeah, you won't be disadvantaged. The only downside is there is no guarantee. So you need to kind of be in the top percentage of people that do want to transfer.
Great. Well, we have no more questions and we are pretty much at time. But just to confirm for everyone, if you do have questions in the future, you can contact the course information team. That's the team I'm from. We're all students here at Western Sydney University. We're trained well enough that we can answer, anyone in the team can answer most of the things that we've discussed today. My role today was just to get the academics to answer these questions, but our team is well enough across these things that we could definitely answer these questions for you if you have them in the future. And if we don't know the answers, well, we know the people who would be able to help you out, or help us help you out, and things like that. But thank you everyone for joining us today. And simply good luck with your applications.
Yeah. And thank you, Brendan.
In your favor.
Yeah, thanks, Brendan. Thanks, everybody.
Yeah, thanks.